Thanks. The planning committee wanted to give you a sense of the innovative financing vehicles that are developing to support population health initiatives. I think we succeeded beyond our wildest dreams. I just want to say that there's more. We intentionally wanted to focus on 2 or 3 vehicles and give you an in-depth look because we thought it was important to do that. We could have added other ones in terms of program-related investments by philanthropic organizations, community on health and wellness trusts, and other vehicles that are developing out there. There's also, as you know, a lot of work going on revising payment models for clinical services to support population health, and we didn't touch on that. There's also program-related, cross-program-related through waiver, 1115 waivers, and the Maryland Global Payment Waiver that was just approved by CMS, which are also, so there's a very dynamic environment out there of vehicles to support the work that we're talking about. I want us to go back to David's introduction because he started by talking about 2 communities, 2 states that were getting good results but had very different settings, and emphasizing the point that the important work of developing an agenda for improving the health of a population area is community specific. We've had a lot, I think virtually every one of the panels at some point in their conversations talked about the community and how and what kind of a structure can we create at the community level in order to move this agenda forward. So I want to shift our conversation from talking about the individual vehicles and funding individual initiatives and saying, what is it that would create a set of interventions within a given area that would address the needs of that area and move the needle forward, not on an individual initiative by initiative basis, but on an overall basis over time. The second question is, coming back to David's point, what would be a sustainable financial model for supporting that kind of infrastructure that would get us out of this cycle of grant-supported initiatives that terminate and the vehicle goes away. So, can it bring up on the screen?
No,
the front screen?
The monitor up here isn't working.
Yeah, I don't have a hard copy in front of me. So we have is, the starting point is the key role of the community in improving health. Whoops. There's a hard copy. Great. Thank you. So part of what needs to be done is, in order to achieve the results we're looking for, is we need an entity which can integrate clinical services, because we know that is part of the story, public health initiatives and public health programs, and community-based services and initiatives to address the upstream determinants of health. The elusive holy grail on this initiative has been the sustainable financial model. There's a growing inventory of the financial vehicles we've just been through, and the issue and concern is the prospect for, if we simply do this one at a time, the fragmentation and lack of cohesiveness and the lack of ability to really meet the needs of the community as a whole. So the heart of the model that I'm proposing is that we've heard the word portfolio used a number of times during the course of the day. And what we're talking about is a balanced portfolio of interventions with partial capture of savings in order to create that virtuous cycle of money for reinvestment. The balanced portfolio is balanced in a couple of dimensions. One of the dimensions is time frame. There are interventions that have short-term results, medium-term results, long-term results. And I think that it's clear that in order to meet the needs of most communities, you will have to have a range of initiatives that span that time frame, that spectrum. There's been a lot of concern about how do we finance the particular interventions with longer term horizons. I think we've seen some examples today of how that might be possible. But there's another dimension of the balancing that I want to emphasize, which is the risk profile. We just heard from the social impact balance that they're looking for clear evidence, and it doesn't have to be an RCT, but you need evidence that the intervention is going to work. We also need at this stage of development to be able to test and try out interventions which have not had the evidence developed, which are higher risk, but will give us the opportunity to create the evidence that we need for scale. And I believe that these community-based structures are laboratories, and we should view them as laboratories for that kind of test and the development of the evidence we were talking about before. The second point is the work of Rethink Health and others who looked at this is you cannot sustain this over the long haul unless you have a mechanism for capturing some of the benefits, some of the savings that are occurring from the interventions and funneling them back into the community for reinvestment. It's a fundamental principle. It doesn't work, and that's at the heart of anything we have to put together. The mechanism for doing that would be established with each partner. It's going to be different for different types of interventions and different vehicles, but it's critical for that long-term sustainability. So what we're talking about is a community-level structure which can aggregate and align revenue streams and capital to meet the needs of the community, and very importantly, can leverage both private and public funds to achieve greater impact over time. So that's the basic concept. So this is a flow chart, okay, a simple diagram of how that might work. It's a sample, like what I'm calling community health system. It could also be an accountable health community, an integrator, a backbone organization. We've heard lots of different names for it, but I think we're talking about the same general kind of concept, which is an entity which is built at the community level. Some of the familiar functions of that are aligning stakeholders and prioritizing community needs, bringing the people to the table, reconciling some of the issues and saying, what are the needs of our community? That's something that we have prototypes and examples of that are doing. It also has a function of establishing a continuous quality improvement program which monitors performance and that makes adjustments based on what's happening. A new dimension that we're adding based on the conversation today is managing that balanced portfolio and total investment pool and having the expertise in order to do that. So that's the integrator organization in the upper bubble. Down below is a sample of an investment portfolio, just to give some examples. This is showing initiatives with different time frames, with short-term on the one side going to long-term in the other. And these are specific examples of an intervention, a short-term intervention on the medical and social services continuum, partnering with an intervention with the high-risk, high utilizers, which shows sort of short-term results, a behavior management intervention in the middle as an intermediate term, a YMCA diabetes prevention program, and a social determinants of health on the left-hand side. The example being the early childhood intervention funded by the social impact fund that Goldman Sachs was talking about. So this is just a sample to say this is how you could have a balanced portfolio going across the spectrum. This takes it the next step and says, for each one of those interventions, having the integrator organization, the community health system, share in the savings. For example, on the social impact bond for early childhood, it could be one of the investors in the social impact bond and get its return from that. For the behavior modification program, it could be a value-added partner to a health plan in terms of, and have a relationship, a contract with them in which, again, it would share it'd be a performance-based contract, sharing in the savings, et cetera. The returns from those savings, shared savings, follow the green arrow back up to a wellness fund that is administered by that local community organization and is funded, and has initial seed funding from community-based financial commitment, grant funding, et cetera. But over time, as this portfolio develops and matures, the primary funding would come from the shared saving. So just wanted to capture that sense of, again, a community-based integrator backbone organization which has key functions, including some fairly sophisticated broker capability and financial analysis, financial management capabilities, which would let it conduct and sponsor feasibility studies like the one we were talking about, identify the potential partners that could do the execution, identify the appropriate risk financing vehicle, which had the risk profile and the time horizon, which matched with the intervention and putting that story together. So I think there are going to be opportunities for testing the creation. There's no such organization actually exists in this country right now. I mean, this is a conceptual model. I think we have prototypes out there in terms of some of the communities that some of the examples have been cited during the day. The Rethink Health communities, including Pueblo, Colorado, and others are going on it. The RWJ, Aligning Forces for Quality. You have community organizations and infrastructures that have been built. But so you have starting points for this, and I think that it's an important task over the near future to test some of those. Test, how do we do this and how do we put it in place? If not, we run the danger of the financing vehicles actually outrunning our capability to integrate them at the community level in an effective way. And that, if this thing hits a tipping point and starts running with it, that's going to happen. So I think there's really an imperative to say, how do we create the structure at the community level? What are the enabling structures at the state level and the federal level which support that and put that in place and let us grow that kind of capability? So thank you.
We'll go to Jeff now, and then we'll have questions.